Dr. Meunier, thank you for joining this discussion about cancer survivorship and the right to be forgotten. Maybe before we begin the discussion about the development of the right to be forgotten across Europe, it would be beneficial for us to describe or define what the right to be forgotten means in the context of cancer survivors. So how would you define it?
Thank you. Thank you for giving me the opportunity to speak about a topic very close to my heart. Yes, indeed, the right to be forgotten for cancer survivors is a specific concept, meaning that the patient who is cured should not be discriminated or penalized because he had cancer. So this is to be distinguished from the right to be forgotten linked to the GDPR. This has nothing to do, it's a separate issue. It's just the fact that cancer should not be taken into account. In fact, it's the cancer who should be forgotten.
You were the Director General of the European Organization for Research and Treatment of Cancer for 24 years, from 1991 to 2015. And you're also a scientific member of the European Cancer Patient Coalition and a member of the Belgian Royal Academy of Medicine. So I wonder, as a doctor and researcher, when did you recognize the problem cancer diagnosis presents for patient survivors? How did you get involved in the advocacy for the right to be forgotten?
I initiated these activities on the right to be forgotten in 2013 when I prepared the first Cancer Survivorship Summit, which took place in January 2014. And what motivated my action at that time is that I observed tremendous progress in the field of medical care for patients with cancer. As when I was graduated as a medical doctor in 1974, announcing the diagnosis of cancer to a patient was a death sentence. For many cancer, we had no real effective treatment, and the survival rate were dismissal. While throughout the time of my medical career, over 45 years, I observed tremendous progress and a major improvement in survivorship of patients with cancer. Let it be breast cancer, testis cancer, Hodgkin disease, children leukemia, many. But the society did not realize, did not cope with the success of the medical field. And the society, meaning the employer, the banker, the insurer, did not realize that cancer was no longer a death sentence. And that's how I initiated the concept of cancer survivorship, particularly for financial toxicity. I concentrate now my activities on financial toxicity, and I was very much inspired by the French pioneer work with the first legal framework on the right to be forgotten, which was agreed in 2016. So this was the initial step moving forward towards a right to be forgotten on an European level, because it's unfair for other cancer survivors in other countries than France not to benefit from similar action that were taken and proven effective in France.
To understand the problem better, when you say financial toxicity, can you illustrate that with patient stories that you came across? What kind of examples did you observe with patients that were kind of victims of the financial toxicity?
Oh, there are plenty of examples of patients to whom we, medical doctor, medical oncologist, we tell you are cured, live your life. We no longer need to do all those tests and to do a follow-up every 6 months, perhaps once a year or even not at all. And facing that, the patient came back to us, and particularly to me, and I have two vivid examples in my close contact. saying, yes, live your life, but we cannot buy an apartment or a home. The first, for example, is a young woman with Hodgkin disease. She's a civil engineer, very smart. She developed Hodgkin during the last year of university. Despite chemotherapy, she succeeded her study. She is now an engineer in a large company. She got two kids. She was married. She got two kids. She is now 43. And she cannot get a loan to buy a own home while she is really effective in life and working and well. That is one example. I'll give you another example. Also a young woman, a lawyer, who developed brain tumor more than 10 years ago. And she had to stop to work for a while. She had surgery. And then she was very well. She is a very successful lawyer. She moved from Belgium to Luxembourg. And neither in Belgium nor in Luxembourg, now that we are 10 years later, she could get, I speak about 2 years ago, so she was at 8 years after surgery. She could not get a loan. So here I have two examples of two very active women working, feeling well, but stopped in their project by financial, what I call, and what is called by other financial toxicity.
What do patients do in such cases? So they can't get a loan. So what's usually the next step for them?
Either their partner or husband can take the loan on their own name, or their parents or family, or they can just decide to take a smaller home or a small apartment or not rent something instead of buying. But it's also true for other cancer survivors who need to buy, for example, a car for doing their job and so on. So it's not only restricted to loan and mortgage to buy your property, but it's also for professional loans.
Mm-hmm. The right to be forgotten has been most developed, or the whole story has been most advanced in France, and that's also what inspired you. So can you describe the evolution of the right to be forgotten in France so we understand how the society took the approach towards this right?
It was an initiative taken by the INCA, Institut National du Cancer, who put together the insurer and banker and the legal responsible and decide on common agreement to initiate this droit à l'oubli. Initially in restricted framework with 10 years, so you had to wait 10 years after the end of treatment to have the right to be forgotten, that is, that cancer cannot be taken against you when you ask for a loan or a mortgage. That was the main framework that was put in action in 2016. And now we are in 2022 and we have significant feedback from the last year showing that actually it's very effective. And it's even so that recently, in 2022, in France, they have decided to decrease the time, the delay, from 10 years to 5 years. And in addition, another major step to me is that they announce that they are stopping to require a medical questionnaire. That is really important, the medical questionnaire, in specific circumstances, such as loan of 200,000 euros per person. So it means if you have a partner, it's 400,000, but 200,000 per person to be reimbursed by the age of 60. So in that framework, you don't need to have a medical question, which is a significant step, which also should inspire the whole year.
Hmm. Only a handful of countries in Europe are working on the right to be forgotten. So, in that context, what was the sentiment in France that these changes occur? Was the advocacy so strong? Was the public debate so loud? What were the factors that contributed to these constant improvements that we see?
Yes, in France there was a group of patient advocacy with breast cancer, which was extremely active and extremely instrumental. And I started, as I say, in 2016 after the French legal framework. I started to say, yes, this is very nice, but it has to be extended. Since I have always been working on the European level, I don't see why other European citizens should not benefit from the same framework. And so, indeed, Belgium followed, Netherlands, Luxembourg, Portugal, and now there are 4 other countries who are actively working on such a legal framework, which is Italy, Romania, Cyprus, and Ireland. So there are 4 new countries trying to also implement it. But meanwhile, in parallel, the European Commission and the European Parliament has been also very much involved in this through the European Beating Cancer Plan, which was set up, which include the right to be forgotten and the action of the European Parliament through the BECA, the Committee Against Cancer. And in addition, the European Commission organized also the Cancer Mission, which is a major research program on cancer. And among the priorities recommended by the board of the mission, there is also research on the right to be forgotten. So we have 2 major European instruments, the Beating Cancer Plan and the Cancer Mission, which are addressing the issue on the right to be forgotten. Now the concept has gone through. Another major step has been taken this presidency, under the French presidency, through a political declaration which was signed by the trio, the French, the Czech, and the Sweden, which is going to be pursued through the Czech presidency and the Swedish presidency. And in that political declaration, Action 24 requires that the right to be forgotten would be indeed promoted throughout all EU countries. But in addition, they took one of my recommendations, which is to install, to create a network, an implementation network with experts from the 5 countries who have already the law, in order for the other not to reinvent the wheel and to base the legal framework on an European level on the same principle. We can accept some specificity, some national specificity and modalities. For example, because the cost of housing is totally different in Luxembourg or in Romania or in other countries, so we can adapt the level of mortgage, for example, but the same principle should prevail. So this is really important, that this implementation network with expertise from countries who live it through it would be taken into account instead of accelerate the process. What the commissioner is wishing is that by 2024, the right to be forgotten would be accepted and available initially as a code of conduct, which is not binding, which is guidelines, recommendation, which I don't consider it strong enough, but it has been accepted as such, and it is a first step. And I think the more we have observation of several years behind us, like in France, the more people will be confident that it is not a catastrophic situation. And to my knowledge, there is no single French insurance company which became bankrupt because of the initiation of the right to be forgotten. On the contrary, since now, themselves, Crédit Mutuel in France, the largest insurer, decide to withdraw the medical questionnaire. So it shows that it is effective and it doesn't affect the financial success.